Dear guests, dear colleagues, my name is Artur Tunyan. I am advisor to Minister, Head of Staff of the Government of Armenia. This is Armenian, let's say, Prime Minister Chancellery. And I am also Director of State-owned Ekeng Corporation, which is a main entity within government for e-governance projects. We also, again, it's also certificate authority of Armenia, the only certificate of Armenia, which is issuing electronic signatures for EIDs all over Armenia. So basically, I'm trying to switch on. Okay. Okay. I'm trying to, actually, I would like to present you one of the biggest projects that we are implementing. We finished developing, and now we are at the stage of integration and real implementation in life. It's very critical, and I believe this is one of the critical infrastructures in any country if you develop to the level that we did. eHealth project that we started several years ago is now ready to launch, and we are in the stage of adopting legal documentation for its implementation. So I'll talk about eHealth in Armenia and the problems related with this. So what was the project objective when we started back in 2010, around that? We decided that we need an integrated single window for health-related services and manage all the state and private medical institutions with the goal to raise efficiency of health-related services. This is the main goal, really. And there was some part of in Armenia, but I will describe you how the situation currently, and I believe in many countries on Eastern Partnership, is like this. Citizen is really lost between different medical institutions, between, let's say, state institutions, like Ministry of Health, medical service providers, insurance companies. So it's a mess, really. And if you need to get some, let's say, documentation, you need to apply to every single institution separately. What we expect after launching the system, that you are just sitting in your office, in your home, at your home, over the desk, and you have access to all your records. You may apply for services, definitely for treatment. You should go to hospital, like, primary institution, but as a minimum, you may make appointments, you may have access to your medical data, and you may transfer your medical data to authorized person. So this is more organized. Definitely, if you are trying to launch this critical infrastructure or this project like this, you need to consider that you must have several databases to raise this efficiency or to make it possible to work. So these are just a list of several, not limited, let's say, databases we already integrated to. Definitely, you need state public register, which includes all the personal data on identity. Another critical infrastructure is drug registry in your country. Social security database, because very often you just interact with socially unprotected people. So you need blood repository, there is a mistake, epidemiology registry, and registry of civil status of your citizens. Another critical part that is not listed here definitely is public infrastructure, which we have in Armenia, because this is really important. Otherwise, you cannot keep your data, authorize all, let's say, institutions or persons to use your data or have access, strong authenticated access. So in general, architecture of the system is like this. We have several databases, and it's centralized, it's web-based service. From organizational part, we are going to set up a specific operator who would be running the system. And since the system is web-based, you would have access to any record in the system if you have your authorization. So what we expect, and I hope we would have the early results next year already. We would definitely, under our estimates, we would have higher quality of medical services, we would make some business processes transformation, even within medical institutions. Medical data storage, secure storage. Statistics for the government. Believe me, it's very important. Any government needs this statistical data, but unfortunately, if you have no system like this, you have no real reliable statistics. And for decision making, it's really important. And key elements of the system is electronic medical record for any citizen. If you look in the system, it looks like you see your, let's say, Facebook page on your medical history, but it is like this, but it's very important. You know that in many countries, especially in previous Soviet countries, we have these paper-based ambulatory cards or whatever, and they are often lost, not all the information there. If you go to doctors, it doesn't mean that you always get it with you or things like this. So it's really critical to have electronic medical record in the system. Even in emergency situation, if doctor access to your records, they need to know what are your, let's say, precautions that they should take into account when they are making treatment. So what generally beneficiaries gain? I would just name 3 groups of beneficiaries. These are citizens, medical institutions and medical staff, and the government. So for citizens, it's definitely higher quality for medical services and access to resources and more safe treatment, safer treatment. I can explain why it is safer, because if you don't have, as in a previous example, you don't have your medical record in hand, doctors cannot give you the best treatment. And very often medical mistakes happen just because of this lack of information. What is for medical institutions? They would be able to optimize the processes and make a real management of their resources. The system would allow to make appointments for resources, for availability, etc. For example, if you have, let's say, specific equipment that need to be used, you may have scheduling of access to this resource. And definitely, all of this would bring some reducing the cost for the medical institutions, and time would be much less than in regular way. Another critical part or sector or beneficiary is the government. I believe in many countries this is a really critical issue. Transparency of the health system in terms of financing and cost. Health system in any country is very important, and significant part of state budget goes to health system. And usually the problem exists that you cannot control really whether was it efficient or whether right place was done, let's say, transfer the money and things like this. Without a system like this, again, believe me, you can have a lot of papers, reports, but cheating on this is very usual in any country. So definitely I mentioned getting precise statistical data. You can make policy decisions, you can have situation control, epidemiology control, and things like this. And definitely, based on this, we created a system that I mentioned started back in 2010. These are the phases I'll try to explain, though it's in Armenian, but I'll try to explain. In 2012, we started, let's say, drafting terms of reference and implementing for the procurement. And since then, there were several phases. It's there are a lot of challenges in this project implementation, and believe me, many of beneficiaries or many even public institutions object or resist to systems like this. They feel fine with everything that is going on, and they resist on everything that's possible, whichever is possible. So in 2015, we already made a pilot in 6 medical institutions. And in 2016, we completed the project for development stage. We have the system running now. We have hardware procured for this. And we even tried to use it on Amazon. It works well, perfectly. So starting from this point, we are working on creating an operator and legal framework for implementing this. Our goal is that by the end of this year, all the medical institutions should be connected. And this is just statistical data for Armenia, how many potential users of the system just on medical part would be available. So if you look on medical institutions number, we have primary institutions. These are polyclinics and institutions like this, hospitals, dentist offices, pharmacies, and we have human resources like doctors and nurses, around 25,000 people, and system based on idea that every medical person has access, has its role in the system, and every citizen has its own access and let's say to the system, to its records. Definitely the system would provide also access to state agencies and institutions like ministry or other agencies which need to get some information or reporting. So this is in general what we did, and if you have questions, I can answer to your question. Thank you.
Thank you very much for this excellent presentation. And any questions, comments about this project? I think it's a really challenging project actually, because covering all medical system. Any questions, comments? I have a question. How you handle the data protection issue around it?
Okay, this one, actually this issue was one of the critical that we were addressing. So any access to the system is done by strong authentication, using only EID cards. With your PIN, personal PIN, you may access to the system. And I will just mention that this system would be driving force also for higher penetration for EIDs. We have a goal that any medical, let's say, primary medical assistance will be provided only to people who have EIDs. So this is just an example how you can raise your penetration for EIDs. We are planning.
So those who do not have IDs, they die.
Yeah, actually, we announced that, let's say, 6 months later, if you don't have EID, then you don't get, let's say, access to your primary medical service. Okay. I mean, definitely the system has logging. Definitely the system has authorization, let's say, restrictions and things like that.
Yeah. There is a question, please. Yes.
Do you have any estimates how much did it cost to implement this system?
So I can give you, let's say, open data. So actually the project itself was implemented in cooperation with Nikola Tesla, Ericsson Nikola Tesla company from Croatia and Armenian local company. It was World Bank procurement. The number that I will give you just, let's say, World Bank open data, but sure. I mean, it's around $1 million just for implementation. But please consider this for Ericsson, it was just promo entrance to the market. I mean, because the cost really is higher for systems like this. I cannot count how much resources we, let's say, inputted, but another $1 million for initial hardware setup. So let's say $2 million for Armenia at the moment. But further, there would be some service fee that operator would be charging from medical institutions or doctors to have access to the system.
Can you clarify how far it is? Are all those hospitals you showed in the last slide, are they all now connected already, or?
Actually, no, they are not connected yet. Since the system is web-based,
Okay.
you need only internet access and you are connected.
Yeah.
Operator would provide your, let's say, access credentials and you are connected.
And how you are motivating hospitals to join?
There's, let's say, a system of motivation like government tool. So.
Yeah, no, it's
So,
very good tool,
I can
actually.
explain.
Yeah.
Actually, this is one of the challenges, really,
Yeah.
because many medical institutions, especially state-owned, because privates are more interested, really. They organize their work and control the situation. But state-owned institutions resist. Why? Because they get out of, let's say, uncontrolled financial flows. And motivation is following. If you are not connected by a specific time, then you don't get access to state budget resources financed for the medical service. It's for medical. I mean, this is one of the ways you should do.
Yeah, pretty fair. Yeah.
Yeah, I mean, this is main, let's say, objective.
Okay. Yeah. Okay. And the last question. Yeah, please. Please use microphone. Otherwise, we. Oh, yeah. Okay.
Hi.
Yeah, no, but it's okay. Okay. Yeah. Please go ahead. Yeah.
I have two questions actually. The first one is, did you implement any amendments into the legislation? I mean, there is a legislation about the medical secrecy, and as I understood, you're already exchanging data between the state registry and the medical electronic data. Somehow these data have to be exchanged. So did you apply this into the amended legislation? First question. And the second one, I saw that electronic medical record, is that, I just wonder what platform you used, like Open EMR, or you've developed your own software. Thank you.
Okay, I'll start from the last, let's say, part. Actually, there are different models and systems in, let's say, platforms in the system. Most of them are open source, let's say, platforms. Though some parts are, let's say, owned by Ericsson and local partner. Concerning data protection, just last year, we adopted data protection law, and there are some data which is open and considered under law as, let's say, easily transferred between agencies or between, let's say, citizens. Some part is not. Definitely, medical record is under secrecy, and this is treated as much as possible to protect it. Medical records wouldn't be transferred to any agency or any, let's say, medical person, doctor, without pre-authorization by the citizen. So we have specific forms, we have specific electronic access forms, like using EID, PIN, etc., that you need pre-authorize your doctor for specific time, or hospital for, even the hospital, there are different ways, like you may authorize doctor, you may authorize division, you may authorize hospital or whatever, to access to your medical record. And everything is logged, logging system is running, and if you find, let's say, that somebody used your medical record without your authorization, you can apply to my colleague's office on the Personal Data Protection Agency with the Ministry of Justice, and they would investigate the case. Just give you another example very shortly. There may be situation when there is a necessity to access to your medical records. This is also logged, but you need to, I mean, doctor can access to your medical record if you are in coma, for example, and you need a treatment. But this is a situation, emergency situation, when doctors should make specific notes that why and when and under what circumstances they access to your medical records.
Okay, many thanks for this excellent presentation. We will unfortunately need to go further, and we have later also opportunity to discuss. So thank you very much, Armenia. And applause.